Bonjour tout le monde, je suis Linda Silas, présidente nationale de la Fédération canadienne des syndicats d'infirmières et infirmiers. Et guess what? Nous sommes à Niagara Falls à notre convention bienniale. Un gros bienvenue de mon conseil d'administration. Bonjour everyone, I'm Linda Silas, your National President of the Canadian Federation of Nurses Union, and welcome to our 2025 Biennium Convention in beautiful Niagara Falls.
And dive in deep. I'm all in, I'm running head first into the sun. I'm all in, I'm right on the edge. It's all or nothing, I'm finally free.
When we're looking at 2025, it's almost a turning point. How are we going to fine-tune the activities we're doing, the efforts we're doing to support our members?
The best way to get nurses involved is really getting out there and being part of the movement. And that's what we want to see. Get out on the street, make sure you write to your politicians, make sure you write to the people in power, make sure our administrators know what's happening so that we can be heard and know that we are valued.
On to faith, and my heart was lost and I was blind, but now I take the lead and dive in deep. I'm all in now. At first I'm going all in. I'm right back.
Nobody got into nursing to give bare minimum care. And so if you don't have enough nurses to patients, you end up giving bare minimum care, doing bare minimum tasks, and you're just not giving that good quality patient care that everybody wants to give. So patients aren't getting their medications on time, they're not getting mobilized, they have longer hospital stays, they might get readmitted, they might get infections. So you just really need that time to actually spend dedicated to your patients, and you don't have that if you're looking after 8 patients, 10 patients, more than that maybe.
Comme un peu partout dans tout le Canada, le manque de personnel est flagrant. Il nous manque beaucoup d'infirmières ou de LPN. On a beaucoup de postes qui n'est pas comblés. Ceci a beaucoup un impact sur le ratio patient. Des fois, il y a un manque de personnel, il manque d'effectifs. Au niveau de la sécurité, ça a beaucoup d'enjeux. Puis aussi, autant du côté du personnel que des patients.
The expectations on our time and our expertise has grown significantly. Clients are coming home a lot sicker. They need a lot more time and attention. It's getting harder with the nurses we have. We need more.
I'm giving meds for 28 residents and doing everything that is very unsafe for myself and for my residents, and that is sad and that's a shame.
A few years ago, I was physically assaulted in my workplace, and that's where I first came to realize the impact that violence has on healthcare workers. It is kind of expected as part of the job and not dealt with in the same respect that it would be if you're a general member of the public and you're assaulted. Honestly, what I felt most was shame. I felt embarrassment, and I just felt really scared. I felt stripped of all of my professionalism and just incredibly vulnerable. There's activists like myself and many other people that are standing up and we're speaking out that it's never okay to hurt a healthcare worker, but it is coming up against some deaf ears within the leadership within my hospital, and that's been very difficult.
It's very eye-opening to see that a lot of the issues that we face in my province, they're happening all across the country. And at the end of the day, we're all in this together.
All week we've come together to see, what we have in common, which, unfortunately, one of the things we have in common is the privatization of healthcare across our entire country. Here in Ontario, we're no stranger to that at all. We're seeing it everywhere. We're seeing it from BC to Newfoundland, that there's a genuine threat.
We have had several different sectors that are privatized, right from ENT clinics that are simple surgeries that are being pushed off of the public health care into private because there's availability. Socioeconomically, in my industry of community care, we see a lot of people that could never afford that. They're barely making a living trying to pay for groceries and medications.
People have to choose between paying for rent, food, or medicine. I think Canadians need to stand up and fight for pharmacare because we need it.
It made me feel connected to my culture. It made me feel connected with my family that came before me, and it made me feel connected to my relatives, whether that's from the First Nations community or that Métis community. It made me feel like I was part of something that I didn't get to have growing up, and being able to reconnect in that way was so emotional, and I just really love having been able to be a part of it.
We need to listen to our elders, and our elders told us you need to apologize first before you commit, before you pledge to do better.
The more that you learn about history, even in the healthcare sector, the more urgent you will see that reconciliation is. History really matters. It matters for you as nurses because some of those historical impacts may actually still be impacting on the communities that come in, on the Indigenous individuals that come in to seek your care. I also ask of you as allies enough courage to think about the next First Nations daughter, the next Inuk father, the next Métis sister who comes into your facility, to look out for them like they're your daughter, your father, your mother.
I work with the First Nations community back home, and so I'm hearing these stories every day. That's where it's really hitting home for me. It's just heartbreaking that we're still having to have these conversations.
The embodiment of that apology, the recognition of everything that has happened, most importantly, acknowledging that there is so much more work ahead and committing to that is definitely very powerful.
I think what this means for CFNU is that they are moving in the right direction to show that they are an ally for Indigenous people, not just Indigenous people, but Indigenous patients and the Indigenous nurses. I do appreciate the work that CFNU is doing and really asking those hard questions and wanting to address the uncomfortable truth in order to be allies with change.
What we're hearing from the different generation of nurses, it's our time. We need to move. And how do we do it? We do it together.
I'm really stoked to be here. Really stoked. The energy's amazing, and the fight and spark is certainly here amongst us.
Being here this week's been great. I'm learning a lot. I'm making a lot of good connections. I'm seeing a very clear vision of what CFNU wants to do moving forward.
Yesterday, I had the opportunity to meet a nurse from Alberta, and you can hear what's going on for other folks in other unions across the country to see kind of what pressing issues they're facing, and then how do we navigate that together.
This is my first CFNU convention. I'm excited to be here to see the strength, the unity, and the advocacy going on here. And as nursing students, you know, it's a push for us to say that yes, nurses are fighting, we have the voice, we have the power, and we're all in for public health care.
I'm all in for public health care.
We're all in for public health care. All in! We're all in for public health care. We're all in it all.